Well, hi, this is Roy Hall. It's day after Election Day, and I hope your candidates and bills and whatnot got passed or approved. But whatever, it's also the day before my opening of my Cancer Survival of Boot Camp, which is coming out tomorrow. We're going to be talking about that a little bit later on. But tonight, what I want to do is show you a special program. And hang on just a second. Well, hi, this is Roy Hall. I'm having trouble here with my film or my screen. Let's see if we can get this to work. Hang on here. We'll try it this way. It worked about 2 hours ago. Let's try something else here. Hi there. Let's see. There it is. Oh, we're going to get all the uncomfortable stuff out of the way first. Anyway, like I was saying, Roy Hall here, and we finally got you going. And day after Election Day, but the day before, my new program, Cancer Survival of Boot Camp, comes out. And one of the big programs in this program is How to Master Fear. I have a private Facebook group called Mountain Air. If you're not a member of that, I'd suggest you get onto that. Just go to Mountain Air under Facebook and ask to join, and we'll get you into that group. But it's basically a lot of folks, cancer survivors and caregivers, and they're sharing back and forth with tricks they've learned how to get through the cancer process. And one of the big things that I hear in that Facebook group and what I see in my clinic a lot of times is fear. Everybody's afraid. They got tests coming up tomorrow, or they had a test done yesterday and they're going to visit with the doctor tomorrow, and they're just afraid of what that thing might show. So tonight we're talking about mastering fear, and there's one simple technique. I'm going to teach you how to gain your freedom tonight. And again, this is just one part of one of the modules in my program. But basically, it's how to master fear and to empower yourself. And it's something that I've been working with for really the past 15 years. I've seen it work over and over and over. And the idea about beliefs in the mind body is nothing new. Way back in 140 AD, there was a philosopher named Galen, which is Galen. He noted an association between breast cancer and depression at the time. And what we've come to learn is that fear, anger, hopelessness, and guilt are some of the most common undesirable states. And many, many people, whether they have cancer, diabetes, hypertension, the resulting belief of many of these people is, quote, I can't get well, end quote. What I want to do is shatter that thing tonight with you. Now, the number one issue in medicine today is not really heart disease or diabetes or cancer, but rather it's anxiety. You can't believe how many people come into the office every day with trouble sleeping, trouble settling down because they're anxious. And what's happening is they're not going back and trying to figure out what's making them anxious, what is really keeping that mind going to where they can't relax, can't sleep, can't perform at the office, can't perform in a relationship. Then the number one fear, I'd say, and it's just not me saying this, but many other people among those with cancer, is I am going to die from this no matter what I do. The big fear with people about their test is that things are going to be bad, and that means the end is near. And there's just simply no hope. Again, none of this is new. The Quran, if you would jump over to the Muslim people, says that we don't see things as they are, we see things as we are. And you jump back to the Judeo-Christian teachings and Proverbs, it says, as a man thinketh in his heart, so is he. So first off, who in the heck are you, Roy Hall? Well, number one, I'm board certified in internal medicine, medical oncology, and medical acupuncture. I did my training in cancer therapy at MD Anderson Hospital back in the 1980s. I ended up staying on staff an extra year. I thought I wanted to be in academics, and I was in the leukemia myeloma section involved with transplants. And after a year, I learned that I need to be out in the trenches in private practice, and left and moved to my hometown at the time, Lubbock, Texas, where I started private practice. And eventually I got back into academia, teaching at the Texas Tech School of Medicine, where I did my undergraduate or medical degree training, helping to develop bone marrow transplantation. But during all of this time, back in the late 80s, early 90s, I suddenly became very disillusioned and went through a severe case of burnout. And while at the med school there at Texas Tech, I turned in my resignation. I came home, told my wife, guess what, honey, today I quit my job. I just can't do this anymore. And I spent really the next several months doing a lot of reading, doing a lot of thinking about my patients. And what I saw with my patients, there were several groups. One, there was a group that whether they had an easy cancer to treat or a hard cancer to treat, no matter what I did, they did well. Then there was another group of patients who, whether they had an easy cancer to treat or a hard cancer to treat, no matter what I did, they did very badly. And I started looking at these patients, trying to see what is the difference with these people. And somebody introduced me to Bernie Siegel, who is noted to be one of the fathers of mind-body medicine, a Yale-trained surgeon, and got to reading his books, going to some of his sessions, meeting with him. And he got to talking about this radiation therapist named O. Carl Simonton, who was from a city just 100 miles north of where I grew up and where I was practicing, Amarillo. And I remember on a Saturday morning, we were visiting some friends in Oklahoma City. I was reading Carl's book the night before. I said, I got to do this. So I got on the internet somehow and I found his name and phone number in California, called up Carl. I introduced myself. I said, Carl, I'm Roy Hall, a medical oncologist. I'm severely burned out. I can't practice anymore. Can you help me get back into medicine? And because I think you know something I need to know. And Carl's response was, today's Saturday. Can you be in Santa Barbara on Monday? We have a new training session going with our patients. And I says, I'll be there. So I journeyed out to California and spent a week in his sessions with his patients. And basically people would get there on a Sunday morning, and it was the patient with cancer and their support person, usually a husband or a wife or a child. And we spent 5 days of spending a lot of time dealing with the mind-body aspect of cancer therapy. And on Friday, when these folks would go home, they would go home a totally different person than who they came out with or came out as on Sunday. And I worked with Carl for approximately 4 years, going out about every 3 months and working at his sessions, and became certified by him. And he, in turn, got me a job at that time was with Cancer Treatment Centers of America in Illinois. And my wife and I moved out of Texas up to Chicago and worked with those guys for a while. And then I ended up in another holistic clinic in Chicago and eventually left Chicago. But Carl got me back into medicine, doing things totally different than how I was trained at MD Anderson. Now, I was trained to do very high-dose chemotherapy, and I've always done very high-dose chemotherapy, but I've came to learn that there's more of getting people well than pushing the chemotherapy drugs or administering the radiation. And that's where the session comes in. So this was in the early 90s that I worked with Carl, and now for the last 15 years, I've been trying to develop a model and been actively working on this for the last 2 years, and this is coming out finally tomorrow. But anyway, one of the modules in this training session is how to deal with fear. So, first step of what we're going to be doing, trying to master fear, is to identify the emotion that's going on that makes you uncomfortable. And these emotions typically fall into 4 categories, one being fear, the other is anxiety, the other is sadness, and the other is angry. And what you need to do when you start experiencing this uncomfortableness, you need to write down the uncomfortableness you're experiencing and try to identify what it is that's making you uncomfortable. Are you fearful of something? Are you anxious of something? Are you mad at somebody? And it's very, very important to do this work as you're experiencing the emotion. It's no good to say, I'll do this in about an hour when I get home or when nobody else is around. You need to do the work right then and there. So first step is you identify the emotion. And then the second step is to identify, come on slides. Here we go. Is identify the belief associated with that emotion, such as here. I am fearful because of my CEA is going up, or I am anxious because the doctor is calling me back into the clinic before my scheduled appointment time. I am mad because the doctor told me such and such. And the next step is, and this belief means blank. So I am fearful because my test came back abnormal, and this belief means that I am going to die or I'm going to lose the battle with cancer. So you need to identify the belief, state what it means to you, and then what ends up happening. Well, I'm going to give you an example here, a very common one. A woman with breast cancer goes to her doctor, and a test called a CEA, and this could be breast cancer or colon cancer, now is 24, and the last time they checked it, say 2 months ago, it was 12. And with CEA, a normal value is usually below 4. So all of a sudden, this lady becomes very anxious. She's scared. She's fearful. Lots of anxiety. And the thought running through her head is simply, my CEA is rising, which means my cancer is worse and the end is near. So what she's done is she identified the emotion associated with this lab test, and she figured out that the emotion is fear and anxiety. And she translated that into, or she, how do I say, explained or she realized that knowing that the CEA is elevated, in her thinking, that means that her cancer is growing and that she is going to die soon or shortly. So how do we master this fear, this anxiety? Well, there's a psychologist named Dr. Maltzby who came up with a really nice model, and it's something that's very easy to learn and something very easy to do that you can carry with you, that doesn't take any time. The first couple of weeks working with this, it's probably going to take you 20 or 30 minutes to work through the process. But after 1 or 2 times with this, you're going to find that you can do it almost instantaneously or within a couple of minutes driving down the street in your car. But the thing that drives the fear or the anxiety, again, is a statement, my CEA is rising, my cancer is worse, the end is near. And you say, well, what does this mean? Or how do I combat this? Well, Dr. Maltzby came up with 5 questions to ask about these beliefs. And if you get an answer of no to 2 or more of these beliefs, then that belief is not a healthful belief. And healthful, I'm saying HEALTHFUL. It's not a beneficial belief to your health, and it's not good for you, basically. But one of the first questions is, does this fear promote good health? So this woman will be asking, my belief that my CA is rising, my cancer is worse, and the end is near. Does this belief, this fear promote good health? And I think all of us could say, no, it does not promote good health. The next question Dr. Maltzby came up with is, do these fears protect my life and my emotional health? So again, the woman would say, with my CEA rising, meaning my cancer is worse and the end is near, does this fear, this belief protect my life and my emotional health? And I think quite easily all of us could say, oh, heck no, it does not do any of this. Next question Dr. Maltzby came up is, having this fear, this belief that my CEA is rising, does this provide a good feeling? And the answer again is heck no. You know, the lady's nervous and anxious. She's fearful. She can't sleep at night. So again, we got 3 no's now. And now by definition, all we need are 2 to say this is not a good belief to have, and we must convert it to something more helpful or healthful to us. But we still have 2 more questions to ask. And the 4th question is, does this fear resolve any problems? Believing that my CEA is rising, believing that this means my cancer is worse, and believing that this means the end is near, does that resolve any problems with me? Now, unless you don't like your spouse and you hate your kids, then it probably is not solving any of your problems. And the answer again is no. And the last question that Dr. Maltzby said we need to ask of these beliefs is, are these fears based on facts? And honestly, this is the one that trips up most people, and it has to be truly based on facts. And so he would say, knowing that my CA is rising, meaning my cancer is worse, this means my end is near. Is this based on fact? And where most people get caught up with is, yes, a lot of times when a test like this is going up, it means the cancer is worse, but it doesn't always mean that the end is near. And many times, particularly with these blood markers, they can go up because of other reasons, such as infection or smoking. And so he's saying all 3 sentences above, are they based on fact? Well, yes, my CA is rising. There's no doubt about that. But at this point, it's really not based on fact that my cancer is worse, because there can be other things that cause that cancer or that CA to rise. And because of that statement, the last statement is not true, the end is near. And so basically, this thought process with these 5 questions in this scenario, all 5 of these questions are no. They're not beneficial to me. And all it takes, according to Dr. Maltzby, is 2 of these or more to say it's not a healthful or helpful belief. So what do? We wait for the computer to change. That's what we do. Okay. So what we end up doing is replacing the old belief, I am fearful because of my CEA rising. I am anxious because I have to go into the doctor's tomorrow prior to my scheduled appointment. What we end up doing is replacing this old belief with a new belief. And it's not just a positive belief. That what I'm trying to teach tonight is not positive thinking. Positive thinking is good, but I don't think it's always helpful. And a positive thought process or a Pollyanna statement is, my CA is rising and I will go into remission. Yes, it's a very positive statement, and it might hold some truth, but it's not always a very realistic, and what we want is a very realistic and helpful belief. So don't do the positive statement only, don't do the Pollyanna statement, but come up with a new truthful and more empowering belief, such as my CA is elevated and may or may not mean my cancer is worse, but what I do now is important. And I think if you'll read this sentence here and go back to Maltzby's 5 questions, you'll find that This is a very empowering statement and gives room for hope. And hope is very necessary. And again, his questions was, believing that my CA is elevated and that it may or may not mean my cancer is worse, but what I do now is very important. Does that promote good health? And I think you'd have to say, yes, it gives me a little bit of hope, maybe not a lot, but some hope. And you ask, does it protect my life, my emotional health? And I think you'd have to say, yes, this is much more healthful and promoting a good health than the fearful one. Does it provide for a good feeling? And I think, yes, you'd have to say, if I really believe what I do now is important, you're going to feel much better than what you're feeling when you had that fearful idea that you're about to die. Does it resolve any problems? Again, I think the person would say, yes, it resolves lots of problems. I may or may not die. What I do now is very important. And most importantly, is it based upon fact? And I think you'd have to say, yes, it is based on fact, because what I do now can make a big difference on my cancer. Will it always make a big difference? No, but it certainly can. So what you end up doing, and this is where people probably have the hardest time with this program, is coming up with a more truthful, more empowering belief. And the easy way for me to think about it is first come up with that Pollyanna belief, which would be my CA is rising and I'm going to live forever. And somewhere find something in the middle that states the truth, but also gives room for hope and gives room for a good outcome. Now, what do? You say, you've done this work here. What I teach in the course is you write down the unhealthy belief and you write down the new healthy belief. So you write down the belief, my CA is rising, my cancer is worse, and I'm going to die. And then you write down the belief that my CA is rising. It may or may not mean that my cancer is progressing, but what is important is what I do now. And you write that on a piece of paper and you carry it in your purse or you carry it in your back pocket. And for the next 2 weeks, whenever you become fearful or whenever you become anxious, you stop and you identify that emotion that you're experiencing. And then you pull out that sheet of paper and you read the statements and dwell more on the healthy belief than the other belief. And I promise you, within 1 to 2 weeks, you will see a difference. And the anxiety will go down, the fear will dissipate. You know, I've used this program with patients who have severe pain. I remember a lady a couple of years ago, we were in clinic and she all of a sudden became very much in pain. You'd ask her, well, how bad is your pain? And she said it was a 10. And we talked with her. And of course, you know, in the clinics, we don't carry any morphine like the emergency rooms do. So we really have no pain medicine to give out. And so I started asking her, what do you think is making this pain so bad? What's going on in your head? And it ended up coming out that she was just simply scared because she had heard that her chest x-ray was worse and she was more fearful about her cancer progressing. And so we sat down and we did this exercise, and honest to God, over the next 15 minutes, with no acupuncture, with no guided imagery, no hypnotism, no composine to help her relax, but just working on this model, her pain went from a 10 down to a 2. And it lasted. I also have seen friends who go over to their house at night and they're very angry and upset. And there was once about a year ago, some friends of ours, we went over to have dinner and the wife was just, I mean, she was mad and angry at her kids. And we sat down and we said, Linda, what's going on? And she told me, and it came down that she was anxious about one of her kids having to drop out of school and do whatever kids do that drop out of school. And so we sat down at the dinner table and we did this model with her. And honest to God, over about 5 minutes of working with this, her anger resolved and she became peaceful. And she says, you know, I can now say my kid did have to drop out of school, but how that kid and I react now, and the plans we make can make a huge, huge difference in his life to come. And she felt much, much better. So this is Maltby's plan. And I promise it works. There's no gimmicks to it. I've used it over and over in my life. And what ends up happening as you practice it, you can be driving down the street and you have a bad feeling come over you, and you, in your mind at the stoplight, you figure out very quickly what's making you feel that anxiety or that fear or that anger. And after a couple of times of doing this exercise, you know that that emotion is not a healthy emotion. And before the light can change, you come up with a better belief and you're feeling much better, and anxiety goes away. Is it easy to do? No. Is it convenient to do? Yes. Does it work? Yes. And again, what I say do is do it at the moment of the highest intensity of that anger, that fear, that insecurity. Don't wait for an hour, for 2 hours for things to calm down, but do it when you're really feeling crappy. Now, I mentioned my cancer program, and again, it's Cancer Survival, a boot camp. I worked with Carl back in the 1990s for 5 years and been trying to figure out how to do things. And again, that program, the patient and support person would travel out and spend a week. The costs were very expensive, and they'd go back home. What we have developed, and I've been working with some people out of Australia, out of New Zealand, down in Houston, a lady in Czechoslovakia, all these people putting this program together over the past 2 years. And what we've come up with is 9 modules in the program. And what it is online. So you get on your computer when it's good for you, at home when it's easy for you. You and your partner or you alone, and work through these things. They vary between 20 minutes, and I think the longest one is about 45 minutes. But the first module is I Can Get Well. What I'm trying to do here is to show you how to protect your hope and to work on the beliefs that go through your head. You know, unfortunately, the Cancer Society has instilled some really bad images into our heads about cancer. And I know back in 20 years ago, they had a program calling it the dragon that wouldn't die. So all these people had these big images of these dragons breathing fire and little bitty people trying to survive. And there's a lot of these images out there that we just simply have to re-examine and get rid of the bad ones and bring in some new ones. The next module is how to have a successful office visit. My thinking has always been that the patient is a center of the team. He's the captain of the team. He's the president. And doesn't mean you have to know chemotherapy or radiation therapy, just as our president of the United States does not have to know how to exactly wage war or how to do the banking business, but that president of the United States will build a cabinet of those people who know the most, and he'll bring them in and he'll ask each one of them what he thinks they ought to do, and then he'll come up with a plan that makes the most sense to him and hopefully the others too. I think the same thing happens in cancer care. The patient's in the center of the wheel, and on the outside of the wheel, you have your medical oncologist, you have your surgeon, you have your radiation therapist, you have your support people. And there's some other people that I tell you how to bring in, how to find the best of them, such as acupuncture. And I show you how to interact with these people and get the information out of them with the least amount of effort on your part, so that you understand it, so that you can make the best decision on what it is you need to do, and then you follow that road. So you trust the oncologist to be a great chemotherapy person, you trust that surgeon to be a great surgeon, and you follow their suggestions when it makes sense to you, and when it doesn't make sense to you, again, ask for some help from them until you're comfortable doing what it is they're asking you to do. The next module is coming up with a 2-year health plan. What do you have to do to get healthy? And one of the questions I ask a lot of my patients is, what do you do for fun? And I have to tell you, 90% of them say, you know, I used to do, and they'll tell me, and they say, now I don't do it anymore. And I tell you, we have to have fun. We have to have some relaxation. And yes, I know going through chemotherapy, going through surgery, you don't feel like a football player or a soccer player, but there's something we can find that brings enjoyment to your life, which is very important because we know when the mind is at rest and there's fun going on and there's laughter going on, your immune system is stronger and you get more well from the cancer with less effort. Another module is dealing with beliefs and the importance of my health. Just like we talked about the Proverbs statement or the Quran statement, as a man thinketh, so is he. We have to examine a lot of these beliefs, look at how people deal with cancer mentally from image standpoint, and come up with new images where they are able to be, I forgot how to say it, but you can live with that and you can even empower yourself to get over their power. And again, the module talking about what we just did, changing our beliefs from the unhealthy to the healthy. This is one of the modules. There'll be more drills so that you become comfortable with this process. We deal with things such as imagery, the ugly and the good. Again, things out there that we can change, that's easy for us to change to give us more power. Have a module on communication. How do we communicate with each other? How do we deal with our support people? How do we organize our support people so that we get the most benefit from them with the least amount of burnout from those guys so that we can get the best mileage and benefit? One that's really scary with a lot of people is death and recurrence. How do I deal with this? This is a separate module, and one that when you go through it and after you've gone through it, people are much more comfortable with dealing with this issue. And the last module is called Getting Well, the Path. And again, these are lessons that vary anywhere from 20 minutes to, I think the longest one is 40, 45 minutes, most of them between 30 and 40 minutes with some exercises to do afterwards. And initially, I thought I would pull this out or design it so that once a week people received one of these modules over the internet. But then I realized there's some people that want to run through this very quickly. So I said, let's get this program so we can deliver it as people need it. I do ask that as you go through the work that you take your time, and once you mastered the first module or you're comfortable with it, then go to the next module. And don't try to make it a speed race to see how quick you can go through all 9 of them, but take your time, and when you need to do something different or go back over it, you can go back over the program. This is a program that's on the net. There are no CDs with it. And people say, why don't I have a CD to work with that I can use and carry with me? Well, the simple answer is this is always being updated and modified. And with this method here, you can get the program, and in 2 months, when I say come up with a new thing with imagery, including the ugly and the good, I can update that on the internet, and you have instantaneous access to that without having to reorder anything or buy anything new. Now, you're asking, what's it cost, or how do I get this thing? Oh, we are going to have some bonuses. I am in the beginning. There's going to be 3 bonuses coming out. And I say in the beginning because I'm going to go over this in a second here, but 3 of the bonuses that we have that we're working on right now is meditation exercises. There's going to be 9 different types of meditations. Very important to learn how to meditate, but there's all kinds of ways to meditate, from just simply sitting and being still to actively trying to harness that mind to do nothing. So I'm going to show you 9 different models of meditation, and out of those 9, I bet you can find 2 or 3 that work very well with you. We will have a private Facebook group for strictly people going through the program, and the benefit of this is you can get online and ask other people their answers to their problems coming up that are being addressed in this program. You can ask me, and then we're going to have several different live group visits where we get online in a live seminar type thing that we can talk about things and work with each other. Now, again, like I mentioned, there's 9 modules, a couple of benefits, and what I want you to do is go back to thinking, what would this cost if I had to go to my doctor's office? And these prices now are really very low for an oncology practice. But first visit, we always charge a little bit more. But if I charge really my basic rate for coming into the clinic and seeing me to go over these lessons, it'd be at least $175. And most of the time I would be basically forced, because of the way we do our billing, to charge more towards $200 and $250 per visit. So you can see you're talking $2,000 or more for the program if you did it in my clinic, coming to me once a week or once a day, whatnot. The program, I've decided to offer it at $497, but for the next 3 weeks, oops, we went too fast. For the next 3 weeks, because it's a new program, I'm trying to go back for you here. And it's not letting me. But anyway, for the next 3 weeks, it's going to be cut down to $297 with all those benefits. But this is a limited time thing, opened up for 3 weeks, and then the price is going back up to the $497, where it will stay for at least the next several months. And I do have a guarantee to you. And looks like we've missed the slide, but my guarantee, which I can't pull up right now, is that if you're not satisfied with the program and you want your money back within the first month or 30 days, all you got to do is just holler at me and you'll get a full refund, but you'll still have access to the program. So I'm confident, because I've been working with this thing for the last really 15 years and working on the program now actively for 2 years come Thanksgiving, that you're going to find benefit with it. And again, it's going to open up in the morning. What I'd ask you to do, if you're interested, go to royhallmd.com. There's some more information there. Go to my Facebook site, which is Roy Hall MD, and there'll be some information there. Or if you're in the Mountain Air group, which I talked about a while ago, look there. You'll find some information. But anyway, I'm terribly excited about this. It's been my dream. It's been my passion. And now, together, I think we can get you through this. My goal here is not to replace your cancer team at home, but to show you how to get the best cancer team at home, how to best interact with these people, and how to best get you this cancer process with the least amount of effort, the best quality of life, and the shortest period of time. Anyway, that's it tonight. You got questions about the Maltsby questions or the Maltsby thing? Work with it. Email me back. We can get you through this. It works. I know it does. And most of all, thank you for being here tonight, and look forward to working with you down the road. Once again, thank you and good night.